Oh my god, how should I call this title? Um, my banana don't work. Trans banana surgery horrors. Okay, I will not say it because it's the beginning of the video. So, by Buck Angel channel. So don't forget to like, comment, subscribe. Let's watch it.
Stop phalloplasty 7 days. I've been in bed for 7 days. The doctor comes in and says, today you're going to try to walk. And I'm thinking, try to walk? What does that mean?
My dick don't work.
Oh my god.
This is something the trans community does not want to talk about.
Now, bottom surgeries, these are huge money makers. Again, I think this has to be an underestimate that they're quoting around $20,000 for a phalloplasty. There's been different things that I've read that say it could be up to $100,000. Dr. Lineker, who's our surgeon, says that there's entire clinics where the entire clinic is supported just by their phalloplasties, and that is like a fraction of the surgeries that they're doing. These surgeries are labor intensive, they require a lot of follow-ups, they require a lot of OR time, and they make money. They make money for the hospital.
Okay, so we're going to get into this today. I've been holding off on this because I think
so that's what it's all about.
Some people just want to keep things hidden
course.
in the trans community, and I didn't really want to get involved in drama. If an adult wants to do something to their body, they should be able to do it. I don't know. I guess I have mixed feelings about that. Like, if an adult wants to cut off their arms and legs, should we let them do it? Or would we say, wait a minute, something's not right here. We need to...
Oh, come on. No one would want to do that. Oh, police, so, I mean, we didn't saw any kids up into today, so I guess, unless someone claims that wants to become identifies themselves as a snake? Oh, no, but I thought people would do that.
You know, back up a minute. I kind of feel the same way with what they call phalloplasty, which is bottom surgery, which is the surgery to get a penis for a female to male trans person. It wasn't something that was done a lot when I was transitioning over 30 years ago. And for a while there, it wasn't really being done a lot. But I have seen an upswing in it with the invention of TikTok and other trans men talking about it as if it is a good surgery, when I know it is not a good surgery. And I will tell you that I see more people who wish they didn't get it than people saying that it's the best thing that they ever did for themselves, in my opinion. Now, I'm going to get pushback from the trans man community. I don't really care. I just don't care. I don't care what you think. I don't care. This is a service to the young trans people out there who are even thinking about getting this surgery. I have lived a long life without that surgery. Dysphoria sucks. It's not fun, okay? But you got to realize there are some things you can do and some things you cannot do. And I'm telling you right now, you can live your...
This is irreversible, like it's a permanent damage you're doing to yourself for life. Even though it's your right because it's your own body and like you're an adult, okay? Minors, I wouldn't even like, my opinion about that. Like they shouldn't do anything like that, of course. Even taking pills and etc. You guys know my opinion about that already. But if you're an adult, you're responsible for your own actions. If you want to damage your own body, it's up to you. I would rather still prefer you don't, but it's your choice, right? It's your choice. But I still think it's not as much choice to do. Like you want so badly to be someone else, like to be an entire different gender of yours that you modify your genital parts, like it's going to fall. It's going to fall. Even though you still can modify your appearance, like investing a lot of money. I don't think anyone should go as far as changing like the genitals. That's too much. It's my opinion. I don't know. You guys will keep doing that. It's up to you. But the hospitals told already their opinion about it. Do you really want that, huh? Do you know why now they keep pushing this idea that you should change your gender? You know, it's so they can make more money out of you, and that's all. Like, of course, that's not all. That's more than that, but there is also this part of stuff that I don't see a lot of people talking about, and this guy brought to us here like in a very like concise way, and yeah, let's keep watching.
Your life perfectly fine without getting that surgery. And in my opinion, that surgery should never even be on the table. If you remember the guy I interviewed named Scott Nugent, he has so many complications from it. He has been raising awareness around it. Yet there are these doctors it's an experimental surgery. And they're just like they're experimenting on kids. They're experimenting on these young trans men who are females who want to get a penis. Now, thanks so much for liking and subscribing to this channel. Thank you so much for all the awesome comments. And this is going to be a little bit of a graphic, I think. Well, there's not so much graphic stuff. I think there's more kind of just take care of yourself. Some of the stuff these people say, it can be a little bit much, I think. So I just want to give you that little bit of warning there. But I think you can handle it, and I think it's very important. So with that, let's move on to this next video.
I am a reconstructive urologist, and while I do not do gender assignment surgery, I do a lot of reconstruction, and in my training, I did a lot of reconstruction on the urethra and on the pelvic floor. And I think it's important to know that with phalloplasty, with constructing a urethra, that is a procedure that is fraught with many complications, potentially. It is very tricky to recreate a urethra.
There you go.
You don't think about your urethra until something goes wrong with it. But the tissue that's used the tissue that makes up the urethra is very specialized. It's got glands that lubricate. It has special properties that allow it for the passage of urine through that. And if you think about a phalloplasty where you're creating a penis out of other tissue and then creating a urethra, there are many different complications that can occur, such as scarring and strictures. And there are studies showing that strictures are very common.
Yep.
And what that means is that it makes it very difficult to urinate and requires numerous procedures to open up the stricture, to dilate it with a series of metal rods.
Oh my God. I'm feeling the pain just by listening. I'm paying so much attention in what she's saying that it's almost hurting me somehow just by imagining.
Or to reconstruct it. So it's deciding to do a phalloplasty, to go from female to male, and create that urethra.
Do all of this. And I mean, I bet a lot of people that are interested in these surgeries, like, I bet they research a lot, you know. I bet they do all of this, but even so, even with all these complications, with all those problems, they still go and do that. We are talking about not only risking your health, like very severely, but it might be painful as hell. It might be really painful. Like, just imagine having like some complications with stones in your kidney, you know, or something like that. You always see people. I never had, but you always see people suffering a lot with that, and it's just small little stones, like that runs through your to your urethra, and you just spit them out by peeing. with medicine and etc. And it hurts so like a lot. Imagine like having the same pain every time you go pee, because this is what I'm imagining here. Okay, I'm just using the tuberous cells that God gave me. So, if you don't have that tissue that was supposed to be there on the urethra to protect from from the acid, because the urine is an acid. So to protect the other types of tissues from the acid, of course you're gonna have pain, so much pain and complications. So imagine having that pain for life. Oh my God, how people? Oh God, I don't understand.
Is committing yourself to years of monitoring the urethra, working on the urethra, dealing with urethral complications, and numerous surgeries and procedures. So it's something that needs to be entered into very cautiously and wisely.
Thank you.
And something that is going to be a huge commitment with a lot of pain and potential infection, which could spread to your kidneys and throughout your body.
Wow.
As well as
You
numerous
see,
other
you
things,
see. Oh my
that can
God,
go
it's too
wrong.
much problem.
So
It's too
just
much.
something I think you should
Oh,
know
God.
as you're thinking through doing gender reassignment, gender transition.
That's a real medical professional. That person cares. Okay. They're not telling you, oh, you shouldn't do this. It's weird. They are actually telling you the truth. I again repeat also, I don't know if you remember, I did one, I'll put the links to the video I did of a young kid who went through all this. He was like 20 years old. He ended up dying from all of that, from kidney failure, from all of this insane infections he got. Nobody would
Damn.
help him. The doctors who did it to him were literally ignoring him. The same thing happened to Scott Nugent. I mean, all of these people, so many of these young
Because these are not interesting to them. These are not. They are interested in convincing you doing that. After you done that, like they don't care anymore about you. That's it. That is the truth. It is sad, and if you in this spectrum of people who are trying to have these surgeries, you're probably gonna not agree with me, or maybe you are already angry and hating on me because of what I'm saying, because it's not what you want to listen. But look at this. How can you still think that it's a good idea? And there is much more on that. We are talking about your life, your health. How can you still deny all of that and just think that it's a right-wing thing to destroy you because they don't like trans and blah, blah, blah? No, look at this. How can you still think that's a good idea after watching this? And we are still only in 6 minutes of video. No one here is saying to you to don't be the gender that you wanna be or whatever. Just don't do this surgery. Don't do this. Don't do this yourself.
people say that they're not getting.
This is literally mutilation. This is. What else could I call this? Huh? What else? You're damaging yourself for life. You're creating problems to your health that can possibly lead to your death. I don't know. I don't know what to expect out of it.
Getting great aftercare, all of it. It's an experimental surgery. And I just can tell you that, thank you, God, that I never did it. I'm not telling you that I wish I didn't have one. Of course, that was part of my dysphoria. But I just saw the things back in the day that I was like, no way.
I don't understand. I never saw any other video of this guy. So, is he a girl that became a guy, or he's a guy that wanted to become a girl? I don't know, because nowadays we never know, because I don't know if it was a woman who modified the appearance to look like a guy. I don't know. It's the first time I'm seeing his video. So yeah, I don't know.
Is it worth all of that surgery, hours of complications, years of complications, if not forever? It's just, they take a flap they take a flap of your skin off of your forearm to create the phallus, and there's just all these things that they take from your body to create this thing that I don't get it. I actually don't get it. So I hope that some young trans guy is watching me right now. You don't need it. You do not need it. You do some things you're just going to have to deal with not having for the rest of your life. It's not worth it. It literally is not worth it, in my opinion. So now, as she told you, you're going to have a lot of complications. Your urethra, they have to create a whole new one, right? For you to urinate out of. So that's a whole other complication. Think about creating a penis. It's like a very difficult surgery that they don't even have down. It's different to create a vagina than it is to create a penis. And so now I'm going to show you a trans guy, okay, that says something completely opposite of what this. She was a nurse, I think. She's a nurse, told you, okay, who deals with this stuff on a daily basis, okay? And I didn't feel like she was being transphobic. I think she was being very authentic and helpful.
Two most common complications when it comes to phalloplasty has to do with the urethra. One is a stricture, which is the narrowing of the urethra, and one is a fistula, which is a small hole.
Oh
in the
my
urethra.
god.
They're relatively easy fixes and usually just need a catheter in for a longer time.
They're relatively easy fixes, and you only need a catheter in for that. Is just not true. Are you going to believe this person, or are you going to believe an actual nurse who actually works with urethras on a daily basis? I'm gonna go with the nurse. I'm gonna go with the.
And by the way, even if what he said is true, even if what he said is true, like, do you really wanna like to have to go through the difficulties and pain of always needing a catheter to, like, oh my god, it's not worth it. Even if it was true, it's not worth it.
Medical people who have nothing vested in it. This person has something vested in it because he got that surgery. So relatively easy. What does that even mean? Do you know what a catheter? I don't know if any of you out there has ever had a catheter. It is not fun. It does not feel good. It is horrible. I see guys here who have had catheters in for a year.
They use that for stone kidneys, I guess, as well, right? Like, if I remember well, they use that.
Like what? Because they have to get them in and out because they're constantly having infections and UTIs and all kinds of stuff going on with themselves. So the audio on that is a little funky because I had to take the music out for copyright, but I think you can understand him, I hope.
I had multiple strictures, so for me, they took a graft of healthy tissue from behind my ear to replace where the stricture had formed. Another common donor site is from the cheek inside the mouth, and it's called the buccal graft.
Wow.
For more about my phalloplasty or my transition in general.
Wow, so he had to have it done by taking more chunk of something out of his ear, and another thing here, and another thing, acting so nonchalant about it. Just totally like it's normal to have all of these surgeries, and it's like relatively like that, that's the stuff.
I think it's about what he said, like, he's already so invested in that he cannot, like, it feels like he wants to drag other people together with him because he's already on this, even though there is a lot of complications and problems. I don't know. I don't know. I don't understand. Like, I even though I'm saying that, I still think that this person here, even though has all these problems, I still think that it's. I don't know. I'm not in the head of this person, okay, of these people, but probably even with all these complications, they really genuinely still think that. I don't doubt that they still think that this is worth it. The risk. I don't know. I don't know. That's really weird. That's so insane. That's insane.
And why I'm exposing this because they are not being honest with you. They are not being honest with you. You don't want to keep going in the hospital to have surgery after complication.
No one wants that.
It ruins your life. It actually ruins your life. I don't even like being sick, let alone going to the hospital every month or two or year, because you have another infection. So the next one I'm going to bring up.
What up, y'all? It's Jay here. I had phalloplasty in August, so about 4 months ago. As you can see, everything is healing up pretty nicely. It looks good.
Wow.
It looks good. Yeah, I'm just getting on here to talk
No, it doesn't look good. It doesn't look good.
about a complication that I've had since getting surgery, and that'd be my fingers. Basically, it kind of started out as my cuticles, like being a little bit swollen and tender. And then it's progressively gotten worse since then.
What is it?
Basically, when I brought it up
Why?
to my surgeon's attention, they said that they didn't really know what was going on and just kind of brushed it off.
Wow.
It's
Why does this happen? Why the fingers, like he did phalloplasty, why the fingers are like that? Like, it's related to the skin that he removed from the arm, or I
only
don't
gotten
know.
worse since then.
Okay,
so I ended
great.
up going to see a hand surgeon specialist, their office, and they basically said that it was a pyrogenic granuloma. I think that's
So the guy's just going to go in to get a routine penis and then it ends up complications, said it plurally, and now his hand is now something going on with his hand and the doctors don't even know what that is. Oh my God. Wow.
That's the name of it. And then they did a silver nitrate treatment to it, which basically is like this long stick. It looks like a match, but you like get it wet, and they put it on the stuff that was coming out of my freaking cuticle.
Oh my God.
They put it on there, and then it like turned everything black and like basically burned off what looks
What?
It looks kind of like this. They burned it off, and so now
What is it?
it's fallen off, and it still looks like this. And now my fingernails, if you can see,
Gross.
they're like peeling at the base. These two, and then these ones look like this. Is anybody else like? Am I okay? Like, what's going on? Anybody
Yeah.
else experience this? It's been 4 months.
No,
4
you're
months.
not okay. You're not
4
okay.
months, and this is what I've got.
I just really don't understand why the fingers, like, if you did something to your genital part, why the fingers are like that. Like, how is this related? It's related to your arm somehow because you removed the tissue. Maybe you got some weird bacteria because I mean, the tissue protects you from getting sickness and problems, you know? And maybe you got them because you don't have that tissue there anymore. You got a weird bacteria that is attacking your hand. I don't know.
I don't know. And nobody seems to know what's going on. No one knows
They
like
don't.
why this is happening. They've never seen this before. I'm at a loss. Like I don't know. Please comment if you've had anything like this and experienced anything like this. If you know anybody that has had anything like this happen, please comment and give me some direction. I have
Wow.
an appointment next
That is
Monday to,
terrifying.
I guess,
That is
hopefully surgically
terrifying.
remove the whatever's in here. I don't know. I'm at a loss. I don't know what to do.
Oh, I feel so bad for the.
He might need to remove the. Oh God! I really hope. Listen, I really hope that. I don't know what happened to him. I really hope he can be okay. Like I don't know. Like that's so terrible. That's so terrible.
These dudes. I'm sorry, dude, man. You guys don't deserve this. You don't deserve this. It's like, I just wonder, like, what are the steps to even get phalloplasty? I don't think there's long-term mental health. I think you can be saying, I want phalloplasty, and as long as you got insurance or money, you get to have phalloplasty. I also wonder why within the trans male community they aren't being more honest about this. It takes, it just takes a lot to talk about this, and I'm pretty sure of it. But at the same time, why are people sort of telling guys to get this surgery when it's clearly a complete total mess? And not only the physical pain, but the mental pain that you will now have to deal with.
As you could see, there is the economic motivations, like hospitals gains a lot of money, huge piles of money. But also there is of course, the political motivations, You guys know exactly what I'm talking about, okay? Like the Wookiees and etc. You can think whatever you want, but that's about like just pushing this because it's important for them to do so. It's about that. But I still think the main thing is still financial. Like having all these people doing surgeries, all these people like medicating them for hormones, for example, like this makes like big corpus like pharmacies and etc. gain huge piles of money. That's it.
For the rest of your life, because
it's
I'm sure you're pretty at a loss for any.
It's the same reason why they don't create cures for cancer and stuff like that. I bet they could they could have done this at least. I would hint like at least like 3 or 4 decades ago. But they don't do that. They don't push it. They probably even have the cure for like a long time already. They just don't do that. They don't make the remedies for it and etc. because they are not interested to. Why they will cure the people for disease when they are clearly interested in diminish the number, the population number, while also acquiring huge piles of money, make people treat themselves for this permanent sickness until the moment of their deaths. Buying a lot of medications and going to see a lot of doctors and this is all money. This is all money. It's so much like worth to them to keep you sick. It's also so much worth to them to make your healthy life became a huge problem with surgeries like this. That's what it's all about. That's what it's all about. That's it. That's it. You're being used to the purpose of money, of gain money. That's all. Of course, at some level, all of us are, but it's your life you're talking about. You really do that. This level of damage, insane damage to yourself, like. And I bet if you're trans or whatever and you're watching this video, you're probably wondering, oh, but this is the least of the case. These are exceptions. You guys are using exceptions to make us have fear of doing that. Oh my god. Why even let's consider that what you say is true, okay? That these are exceptions to the rule. Would you risk to become one of the exceptions, like you having literally no problem, you being healthy and having no problem in your life? Would you risk to do something like without the need for and maybe become an exception? Would you do that? I would. I only would do any kind of surgery if I only have a risk, and I would weigh the risk with the surgery and knows that my risk with the surgery is it's like less worse than the actual problem that I acquired, And this I'm talking about having a problem, like a physical problem, something that can lead me to my death, Like, I don't know.
Sexual interaction after this goes haywire. And again, what is happening? I really feel like it's some kind of experimental phase to use more to figure out it doesn't work. What?
So, y'all, I have not spoken to y'all probably since like March or whatever. So, yeah, I'm going to just give y'all.
I wonder how much more years we need until everyone figure out that this is not worth. Like, it was supposed to be realized way sooner, but I don't know what's going on with these people that they just live in denial. They don't accept.
A whole month of a rundown, because as y'all know, I had AOT phalloplasty.
But it's like I usually say here, they don't live grounded in reality. They live grounded on feelings. They live for what they feel, what they want to be true. This is the problem. And because of that, they will say that the reality is a lie, and they will pursue what they want. I don't know.
March 7, 2024. And ever since then, I've been having like literally straight complications every week.
Wow.
Every week.
Wow.
I've had a total of 4 surgeries, 2 emergency surgeries, and 2 of them scheduled surgeries.
Oh my god.
I recently just had my 4th emergency. Well, no, 4th surgery, as in 2 days ago.
Hell
and
nah.
that one is 1 out of 2 of the emergency ones.
Wow.
And I just got released from the hospital today. Right. So, yeah. So, I'm going to give y'all a little rundown. So, as you guys know, I had surgery March 7th, okay? You guys also knew that I had to go to rehab after that. So, I had surgery March 7th.
So if you look at his arm, he's got this bandage. That's from the donor site where they have to take the skin. You'll see. I have another guy on here. You're going to see more of it.
Oh my
How
god,
they literally
oh no, this really like make me, I don't know if it's the correct word, chill. Like, this is really insane. I get nervous just by looking. Nervous, not in a sense of angry. Like, you know what I mean? Like, when I look at the arm, oh my god, how you do that to yourself?
You have to rip a flap of skin off your forearm in order to create the
Oh,
phallus.
I don't want to see it.
I got released, I think, March 15th. March 15th, I got released to rehab because I was going to start treatment there, learn how to rewalk and all that extra shit, right?
What?
March 15th, got released to rehab.
Oh, yeah, that's part of the surgery. You have to learn how to re-walk. Yeah, I said that. You have to learn how to re-walk after you get the phallus put on, because it's so traumatizing in that area that everything is just a mess. Just...
Oh
if you guys ever been to Chicago, y'all know the fucking potholes is horrible, so that was the worst ambulance ride to rehab ever in life. But arriving to rehab, I was only there for 2 days. So I got released Friday. I was only there Friday, Saturday, and then Sunday I had to go back to the hospital because my groin area where my penis is was like real heavy. It was like real heavy. It like my bladder felt like 20 pounds. So I had to go back to the hospital. Turns out I caught an infection. Don't know how I caught it. They don't know how I caught it because I literally just got out. Everything in the hospital was sterile. Literally everything.
Probably because you're just peeing and you don't have the same tissue there, like the doctor said before. And the damage caused by the acid, I'm just using my brain cells here, okay? I might be wrong. The damage it causing by this acid rolling through your groin, I don't know how to call it without in a sense of your new banana. the acid running through that caused damage to your tissue, and it became an infection. That's it.
Everything, to my knowledge. I honestly don't think everything in the ambulance and everything in rehab was sterile, so that's how I think I got it.
I find it so weird that it's like a consensus that they never know what is the problem. It's like it almost feel like they are lying. Like they know what is the problem, what caused that, but they will not tell you. It really looks like that. I'm crazy for thinking that. It really looks like that. Like, if I could imagine this, just but with what he said, with my true brain cells here, how can they not know what happened to him? How?
So yeah, ended up back in the hospital for the infection. That was March 19th. Literally,
this
just
is insane.
Got released. No, 50.
This guy has like 4 parts to this thing because he keeps going in and out and in and out. He's over it. He's literally over the fact that he went and did this to his body, and everyone just let him do it to his body. Like, why would they just let him do this to his body? I'm just speechless. I will say it again. I did not have that surgery 30 years ago, and I have lived a fulfilling life. I have 1 surgery, okay? 1. I had a complication with hormones because that's just how it's going to be. Okay, that could be prevented, and I have taught young people on how to prevent that. Yet that's a whole other conversation we to have, because I get called transphobic and all kinds, and a liar. So this community is so insane that they perpetuate these lies within this community, and then these kids get stuck and caught in it, and then they do these insane non-functioning surgeries, and then their whole life, literally your whole life, is ruined for the rest of your life, for the rest, not mentally and physically. I'm so over it and disgusted by this whole thing. So this guy I'm going to bring up next, he has a whole, like, talks about an update in his life and his, but, you know, it's pretty much all the normal stuff. Like, I've been hormones, and he looks great. This, you know, looks like a dude, like, whatever. Looks like everything's working out fine. And then he gets into the fact that, you know, well, his hair is balding, which is one of the side effects. And that's
like, you know, after seeing all these surgeries, like, hormones really doesn't look like a problem anymore. Like, really, it's the Overton window, right? It's the Overton window working here. After seeing all these insanities here, like, hormones are really nothing. I mean, of course they will bring you problems as well. But look at the things we saw here, like. Oh my god, they are nothing close to this. Oh my god, this is so surreal. This is so real.
Gonna have to deal with that. And it's not all roses, friends, to transition. There are things that happen to your body that you're like, what? Like, yeah, that's a fact. So you better really be prepared for this when you do it. It's not just like, whoa, everything is so trans joy. So that being said, then he, after talking about his thinning hair, then he goes into his bottom surgery. So I'm going to start the video from there.
And as far as bottom surgery goes, so I had a complication, like, pretty within the first week of having surgery, which I have a good sized fistula, meaning there's a hole in my urethra.
Okay, there's the hole in the urethra.
Oh my
again.
God,
Pretty much all the dudes'
no,
complications, that's the number one complication.
In the last, like, month or so, I noticed I've got, like, another, it's kind of veering off to the left in another area. I'm sure it's probably been there for a while, and maybe I just now noticed it. So I'm pretty sure there's another fistula. So I did have an appointment with one of my team
this
members
makes me
at Kaiser,
anxious. Oh god.
last month, and we talked about stage 2. I've been working on getting electrolysis done still on my arm.
Because remember what I told you? They have to take a big chunk of your arm skin out, and if there's hair on it, they can't create the penis with hair on it because it will grow into your urethra and cause tons of... So you got to make sure that everything is clean. I mean, it's just I think there's 4 or 5 stages to phalloplasty.
That's also probably another thing that's changed too, is the hair on my arms are definitely thicker than they were way before. I always used to shave them, but now that I'm doing electrolysis, I have to keep them kind of grown out. So definitely changes there as well. But
this really is messing with me. Oh my god.
My nurse at Kaiser, we're gonna shoot for probably January. I should be done with electrolysis by then. And she'll give me the green light for ready to go. Hey guys, Flynn. So transition update, complications update, I should say.
Complications.
I saw the doctor on Friday, very long day. I saw 2 doctors. First one, she basically said that in her experience, she doesn't know that the hole, because it's pretty large, she doesn't know if it is going to bridge the gap and come together. And in her experience, it may have to be sewn closed. She did another test on my urethra to see if there was any fistulas forming, which basically is a hole in the urethra, and or it starts to go a different route. other than where it should go through, which is right through the tip of the penis. So she basically squirted like a lidocaine / saline solution in the tip and watched and see if it went through and out the hole that's now down there. She said it did kind of dribble out just a little bit out of a small area.
Oh my God,
so,
this is so much.
To her, that
he's describing so well that is almost visual. That, oh God, how oh God, I don't understand. I don't understand why. I don't understand why people do that to themselves. I don't understand. I don't.
that was caused sign of a fistula there.
It's
Not
so
a large
also
one, but
painful,
as of right now,
also
that's what it looked like to
complicated.
her.
Which can cause
So
infections, which can cause more complications. Notice everything is complications. It's not a complication. It's all plural.
If I were to have surgery, she said at minimum like 3 months. So I might have to extend my leave to get that repaired.
Wow.
And I guess they kind of do it like a transplant list. Because I have complications, if I do have to have surgery, they put me at the very top of the list. And so those who've already had this stage and haven't had any issues, I hate to say would get bumped so that I can get mine fixed.
It just goes on and on. He's just going on and on about this complication and going back into surgery, and might have to wait 3 months, and then another one comes. It's already hard enough to transition. I just don't understand adding this next layer of complication to your transition. And this is one of the reasons why I have always been so outspoken about not getting the surgery and just keeping my vagina and learning how to deal with it as a man. And it has helped so many trans guys write me and tell me, thank you, fuck,
it's
for
a woman
having that conversation. And, and I just want to reiterate, it's not that I'm telling you not to do it. You go right ahead and do it. What I'm trying to do is show you that you can actually live your life without going to a space like this to have all these complications. Work on your dysphoria. I had the same dysphoria that you had, and I worked on it so hard that I let it go. And I don't think these people are getting enough mental health therapy to walk through this. And why is this need to have a penis so bad when this is what's going to happen to most of you?
I've had an infection for 4 weeks. Let's talk about it.
My God.
It's currently 3, almost 4 a.m. and I am 4 weeks stage 3 phalloplasty. Now, if you don't know what that is I got an arm graft taken to create my phallus.
Oh my
down
God!
below.
Oh my God! No!
I recently got a device
Don't
implanted
show
that will
us.
help me get
erect. It helps them get erect.
That happened 4 weeks ago, and I got 1 testicle implant as well as a pump that reaches into a cylinder that fills with saline to help me get
erect.
So why have I had an infection for 4 weeks? Well, when the device gets implanted, there's a lot of bacteria that can possibly get involved.
What?
And when that gets implanted, because it's a foreign instrument, it can oftentimes cause an infection. So this has manifested for me as a low-grade fever for the last 4 weeks. I think I'm finally on an antibiotic that's working. It's been the 3rd round of antibiotics.
Wow.
So, if by chance these antibiotics don't work, the next stage for me would be to get the device re-implanted, which obviously I'm not hoping to do. But
oh my God.
That would be the next step if I needed to take it. Now, do I regret this? No. I feel so much more comfortable with my body.
Sure.
Because of all of the surgeries I've gotten, especially this last one. And I know that being erect is a big priority for me and leaving my gender dysphoria. So, no, I don't regret this, but Yes, I've had an infection for 4 months.
Do you all know what I think it's called? Do you know what I think it's called? Cost sunk fallacy, where basically you're too far into it to come back. And okay, I'm gonna just say, fine, dude, you might not regret it, but
It's kind of what I said before. Like, he went so far already that he will deny that it was a problem because, because it's not like he's lying to other people, but he's saying this more to keep lying to himself because he's already too far to go back. That's it, That's it. I don't even think it's only for the sake of dragging more people to be like him in the same situation because he repents that, but because no, I don't think one think that consciously, but subconsciously maybe. But I still think that the main reason that they keep saying, no, I'm fine, I'm good. With all of this, I'm still good. Like, I'm nice, I don't repent. It's just because they went too far. It's exactly what he said.
There's something in my heart, and I'm going to just give you my opinion that I don't believe you in any way, shape, or form. I think that if you now have the chance to not do it again, you probably wouldn't do it. There's no way you're okay with this. I've watched your whole TikTok. You're in and out of the hospital constantly, in and out and in and out and in and out, and now you move somewhere far, and you have to take a bus and a plane to go see your surgeon in California because it moved to, like, somewhere else, and
My dick don't work. POV, I have to go see my surgeon, post-op fallow, stage 3. Now, usually we would just drive down the highway, but recently we moved to Washington, and my surgeon is in California, so we hopped on a plane, and we went to go see him because I was in pain every time I wanted to get erect. I haven't done a fallow update in a while, but things have been kinda rough. Not gonna lie, I've been having issues with my perineum, where there's lots of skin issues and pain, but I've seemed to be able to manage that with some lotion and trimming and cleanliness. But I'm having a lot of issues with my erectile device. It seems to be that it's bunched up at the base, causing it to not fully go into the tip and get erect. I will have to get this fixed.
No way. I don't believe it. I just don't believe it. And really, you did all this just to get an erection? This is why they create products that are called, I don't even know if I can say it on YouTube, but I'll bleep it, called a dildo. Seriously, like, really? Come on, man. I just don't believe it. I just won't. I will not believe that this guy feels completely okay with all of this stuff he's been going through. The infections, the having to possibly have resurgery again, all of it. Nope. I don't believe it. Nope. So the next one I have.
All right, guys. So we got another update. So the problem that I'm having and that they saw in the test is that I'm not emptying out my bladder all the way. So I'm peeing, but I'm not emptying it completely out.
Wow.
And I know that I've been doing that because I've been feeling that I haven't been emptying my bladder out all the way. Like, it still feels like I have to pee.
Wow.
Not like in a way that I have a bladder infection, but it feels like I still have to pee, but I kind of just don't because I can't get it to finish for some reason. So because of that, they're going to go in the what's called the voiding trial. So I'm basically going to start peeing on my own. But at the end of each pee, I have to take my cap off of my catheter and then measure the pee that's left in my bladder. And if it is a lot of pee, then the surgeons have to get involved. So
did you notice he also has another catheter inside of him? And then now, if it doesn't work, the surgeons have to get involved.
Hopefully that's not the case.
Oh
my
god.
By Monday, I'll know. Wow. So I have to report back on Friday about how much pee has been left in my bladder. Every single time I've been peeing today, tomorrow, and Friday morning. And if it's a lot, then the surgeons have to get involved. But if it's not a lot, then I should be fine to proceed to go back to work and to schedule my stage 2 bottom surgery.
Oh my god, so he's not even finished. This is his first stage. Remember, it's 4 stages. I would be so over it. I just can't even understand. How are you enjoying your life? Okay, so then I have this guy. I mean, I could show you so many of these. I can't fit them all in the thing because there's just not enough time.
It basically feels like I'm peeing my pants. It feels like the pee is going how it went pre-bottom surgery, through its little path.
What?
And then I'm expecting the feeling of it releasing out at its previous urethral opening, which is no longer there, but instead it keeps going. And so for a little bit, there's like this delay as it's going through the longer urethra, and it feels like it's pooling there. It feels like I'm peeing my pants, even if I'm not wearing pants. And it is a very uncomfortable sensation. The first time I did a voiding trial, I did it in the shower, and it
God, this is so weird.
So bad. It wasn't very euphoric, but afterwards, it is.
It wasn't very euphoric. You see what's happening?
It feels like it's leaking inside of him. It's that possible? It's that what I understood. Like, oh God, like, I don't know what's going on with it. With him, like,
happening. How does any of this sound fun and awesome and trans joy and penis joy? How does any of this sound like that? It sounds insane and wrong. I just want to bring this last one up so that I started with, so that you don't forget where I started, because this is very, very important part of this conversation.
Now, bottom surgeries, these are huge money makers. Again, I think this has to be an underestimate that they're quoting around $20,000.
Exactly.
There's been different things that I've read.
It's what it's all about.
Dr. Winokur, who's our surgeon, says that there's entire clinics where the entire clinic is supported just by their phalloplasties, and that is like a fraction of the surgeries that they're doing. These surgeries are labor intensive, they require a lot of follow-ups, they require a lot of OR time, and they make money. They make money for the hospital.
If that right there doesn't make you see what is going on in this whole trans, gender-affirming care, medical scandal, this is what's happening, okay? It is. It's about money. It's about patience. It's about lifelong patience. They don't like people like me. I went in and out. I'm done. I have to just take my hormones, everything else. I take care of I take supplements. I take things. I work out. I take care of myself. I'm super healthy. They don't like me because I'm not their patient. Okay. So that being said,
exactly.
I just wanted to expose to you. I do not believe this is a healthy part of transitioning, in my opinion. You can push back on me all you want. And if you got it and you're happy, I'm happy for you, friend. But we got to be honest. This stuff isn't what everyone's trying to make it out to be. And a lot of you young people are suffering from getting this surgery. And so I just don't like the fact that there's just so much dishonesty going on in the trans healthcare system. It's disgusting. So with that, thank you all for liking the channel, for subscribing, for these helping me get these videos out there. It really means a lot to me. And I'll see you guys all on the next one.
Before we go any further, I want to take this brief moment here to thank all of you, my patrons, that support my work here on YouTube, and especially my Three-Tailed Fox style members, Heath Rowell, Wallen Wolf, Fenny Sylvy, and Zalost, for the incredible support to my work. Thank you very, very much. You guys are amazing. Also, thanks to all of you who supported me through Ko-Fi or Tron. Thank you very, very much. You can support this channel life and growth with just $5 a month and gain access to many perks. This is less than a burrito. Check out my Patreon, link is in the description below. Yeah, I think we need more people like him to because I mean, he's from inside of the community, you know? It's different when they listen someone like me that is straight, you know, it's an outsider talking. They don't listen in the same way, so they need to listen someone that is inside a bubble. This person this was marvelous in the content of the speech and the proofs and everything. It was very good. Like, yeah, I hope this person like Buck Angel reads the most people he can, so these messages spread around and people stop doing this insanity. Yeah, this video will probably be demonetized, but I will try to upload anyway. Thank you very much for watching. Don't forget to like, comment, subscribe. Check the links below. Patreon, Discord, go find Throne. Support me so I can get the fuck out of this terrible country. And I'll see you all guys in the next one. Bye.